Hello, and welcome back to the Bloomberg Technology Summit. I'm so happy that you've joined us today. As we contemplate the daunting prospect of entering yet a third year of a global pandemic, I can think of few topics as timely as how we access healthcare and mental health care in particular. This morning, I have the privilege of talking to three people who are at the forefront of discovering and developing innovative ways to change the way we access healthcare and make it more accessible. So I'm pleased to welcome Allon Bloch, co-founder and CEO of Health, Russell Glass, Chief Executive Officer of Headspace Health, and Monique Levy, Chief Commercial and Strategy Officer of Woebot Health. Thank you all for joining me today. I want to kick things off with you, Russell, with just a reminder that, according to the CDC, symptoms of anxiety disorder, depressive disorder increased considerably in the US in the early months of the pandemic, as we all know. Why, Russell, why has the pandemic had such a profound impact on our collective mental health? And what has that meant for the acceptance of services like those provided by Headspace? And as you answer, I'd like you to just give an overview of what Headspace is.
Well, thank you for having us and talking about this topic. Obviously, it's critically important. Headspace Health is a end-to-end platform for mental health support and well-being support. And really, we brought together two companies, Headspace and Ginger, to create the most accessible, most comprehensive platform to provide this support at a moment of, as you're saying, huge need. And this was a problem pre-pandemic, but what happened in the pandemic is kind of a perfect storm of mental health pressures and needs. You have social isolation created by the pandemic. You have pressures due to financial issues. And are you going to have a job? And is your company going to survive the pandemic? You have children that are not going to school and they're needing to stay at home and you need to take care of them. You have people who are getting sick and losing their lives, and the worry about all of that together has led to this incredible increase in mental health need. And we see that a doubling of overall need from about 25% of the population with anxiety, depression, acute needs to 50 to 60% now if you look at those under 25. And our belief is that we are in a state of the world where this is something that we have to think about really at crisis proportions.
Allon, on that topic, I want to turn to you next. Centers for Medicare and Medicaid Services reported an 11,000% increase in virtual visits in one of the early weeks of the pandemic compared to pre-pandemic levels. When we spoke before, you talked about us being in a post-COVID world. In your response, tell us what you do at Health, what you meant by being in a post-COVID world, and what's the likelihood that after this is all over, we go back to a place where the default is in-person visits and this whole idea of accessing healthcare using technology kind of falls away by the wayside?
Thank you for having me, and these are all important topics to discuss. Health is a digital primary care platform. People can use K to understand their acute or chronic or preventative needs and get diagnosed and treated remotely by doctors. It's mostly done through chat, through text, sometimes through video, and it's done remotely. We work 24/7 in the 48 continental states. And just to try and answer your question, I think what I meant by post-COVID world is pre-COVID, people went to the doctor or didn't go to the doctor. It was expensive. It was tough. Everybody knew that it wasn't very good. The experience wasn't good and it was too expensive. But telemedicine was seen as this kind of after-hours ad hoc acute care. It wasn't primary care. It wasn't a longitudinal relationship with the patient. You didn't get to know it. It was you used it and then you went to a doctor. And that's what the companies that did that. For me, the term telemedicine is itself is just like saying car phone. We want to be the iPhone. We want to be your doctor. We think that most medicine could be done online, and people should be starting online. It's just easier, faster, better, much, much cheaper, but also just better. And then from there, they should be routed accordingly. Maybe they need a prescription, maybe they need a lab test, maybe they need to see a specialist, but you need to be managed centrally by primary care physician in a centralized manner. And we dramatically need to change the way people access doctors and healthcare and use it, and whether it's for simple stuff or complex stuff. I think most of it can be done online. And so just like people no longer go to the teller, stand in line, pay a fee, and draw out money, and use, say, Venmo today or 1,001 ways to get your money, then why should we go in unless we need to? We've turned going into a doctor into a really, really big, complicated deal, even for every one of us. If you needed to see a doctor right now, it's complicated, whether you have a doctor or not. So why not build a system that's truly 24/7? And why not build a system that works for you, that is trying to help you, that is proactive? I think those are the changes we're going to see. And to me, the exciting thing when I call things post-COVID, during COVID, there were no doctors available. Everybody did everything online. Now, a portion of people have gone back in person, but people also realize that, wow, this is a much, much better way to deal with your acute conditions, with your chronic conditions. So why not do it online as a starting point? Because, it's just so much better.
Thank you. I'm glad you touched on that, and we're going to come back to that in just a minute, but I want to bring Monique into the conversation. Monique, tell us about the unique approach that Woebot brings to providing mental health care. And I'd like you to, while you're doing that, address the subject of stigma. We still live in a society that stigmatizes not only having mental health issues, but asking for help for those, sadly. How do you address that?
Great question. Thanks for having me as well. So Woebot, we develop digital therapeutics. Our lead programs are in maternal health and adolescent health. And our approach is, our core technology is really centered on developing a working alliance or a human level bond. And we do this with a conversational relational agent, which Alison Darcy developed. She's been doing this for about 4 years. And the idea is really about getting into what good therapists have done with people for decades, which is developing that therapeutic relationship where you can really, and the process of therapy, so you can attend to the content and the techniques. And we think that this is the weakest link in digital health, perhaps the whole mental health journey overall, is being able to get into that place where you can do the process and do the work that you need to do. Particularly in digital health, this has been, the market these solutions have been on the market for about 2 decades. And perpetually what happens is that there's weak engagement, partly because of this lack of working alliance. And when it comes to stigma, part of needing this bond is so that you can directly address all of these issues, including the judgment that keep people away from seeking care. There's terrible, if you look at the data around the number of people who have a need and don't make it into seeing the therapist or don't stay in therapy, partly because of the stigma. And interestingly, with AI, it's kind of counterintuitive. Most people would expect that there would be a barrier to using an AI-based chat agent to discuss your psychology and to talk about these things, but it's quite the opposite, is that it removes a lot of the stigma so that you can be able to get directly into the work that you need to do.
I want to stay with you just for a moment, Monique, because going back to the data that I cited from the CDC, they also cite numbers that show that younger adults, racial ethnic minorities, essential workers, unpaid adult caregivers, all reported having experienced disproportionately worse mental health outcomes, increased substance use, elevated suicide ideation. The list goes on. Given the technology industry's historic difficulty, shall we say, in training AI algorithms, which you rely on those a lot for Woebot Health. Given the industry's traditional difficulties with AI, how do you ensure that you can deliver mental health care in a way that's equitable, that addresses the needs of these populations?
Yeah, that's a great point. So we start thinking about that problem. So AI is not, it's a tool. It's one of the tools that we have. It doesn't fix everything. So we use it really judiciously. So that's number one. And then also when we make these solutions, these digital therapeutics, we start with the lived experience of people. And so we start with things like ethnographies, where we start to understand what's the lived experience. And so, for example, in our postpartum depression product, we talked to various cohorts, including typically underrepresented minorities. And we saw that in that perspective, there was not significant differences in how they experienced their mental health, potentially how they access care and other elements. So we start with how we listen and look at the lived experience, and we pull that into the design of the product. And then, of course, when we're delivering, it also depends on how you're interacting with the user. We have very strong design principles around asking and telling, and a lot of self-determination. So when we use the AI, we'll ask the user, is this corresponding with you? And then learning with users and all the things we need to do to make sure that the data is balanced. So a lot of it starts with how you design the product.
So,
Absolutely. Thank you.
Tom, if I could just...
Yeah, go ahead.
I think it's a broader topic, but it's time to start demystifying AI because, as Monique said, it's a tool. It's a really important tool, but why not have the ability to intelligently sift through data and build better systems? This is not some broad general AI. It's built by humans for humans, and you can build better understanding of our patients, whether mental health or primary care. I would kind of be running in to understand how this can be helpful because there's so much data that isn't analyzed today that can be helpful to patients.
Right, but I think one of the questions that comes up is where are we? I mean, just the data that we're collecting, are we collecting it from the right people, the right places? Are we, Monique talked about lived experience. It's easy for, some of us to share a lot of data about our lived experience, but in other instances, we have to work a little bit harder to understand the lived experience of people who we may not have contact with or whom we may not be, accessing or asking the questions of. I'd like to turn to you, Russell, and give you a chance to talk about how at Headspace Health, how you are accounting for underrepresented people who may not have the same access to the care that you're looking to provide.
It's a critically important topic. I think when you have a mission to democratize mental health access around the world, you have to make sure you're thinking about all the different populations, not just those that might be at the highly paid jobs or those that might have great healthcare. It's those also that are underrepresented and don't have access. And so there are a few things that we're doing there. One is, we work with 3,000 enterprises today to help them support their employees and make sure that we are providing support to those employees. But about a year ago, we started to expand into the health plan world and launched our first Medicaid plan in the middle of this year. We launched nationwide with Cigna. So we're starting to add access to those who are historically underrepresented. And the goal there is to ensure, one, that we're learning, that we understand what are the ways you communicate with people who might not have as good access as to things like email or not using email as frequently, people that might need to be reached via text or SMS or other ways. We're also, ensuring that our care provider team, these hundreds of people that are actually providing acts of care, are diversely represented. So a team that has, today 50% historically underrepresented groups within the care providing team to make sure that you can provide experiences for your members that are relevant to their lived experience, that are relevant to their background. And, all the research shows that the closer you can align those lived experiences, the better the outcomes of the care itself. Finally, as we think about data, we talked about AI. We use a tremendous amount of data in order to personalize care and ensure that we are moving people through the right pathways. it becomes critically important that you're thoughtful about the biases that can show up in data collection and how you're leveraging that data. We're actually standing up an ethics team as we continue to build AI to make sure that we're thinking about these things and using it in a privacy and secure, safe way.
Thank you. Alon, I want to come back to you, a topic that you touched on earlier, and that is, the spectrum of healthcare. I can understand, I can get my head around using technology and using chatbots, using Zoom and online tools for things like primary care and checking symptoms, having maybe a conversation with a mental health care provider. But when it comes to more acute kinds of care, ER, long-term diseases, for example, aren't we all just subject to the same dysfunctional, extremely costly and inequitable healthcare system that exists in the US? I mean, how do we solve for that? Start with you, Alon.
There's a few questions wrapped into that question, so we're not going to solve it all in this panel. Look, I think you need to tip the scale and give people, patients, empowerment to understand what's going on, what their alternatives, and put them in front of data and make it really easy and accessible to do that. First of all, turn it from a big deal into a small deal. Demystify big terms in Latin, make people understand. People also need to understand the cost. And then most of the time, they can resolve their things online. Maybe yes, maybe no. Maybe they need to be referred to a specialist or to do a certain very specific test and needs to be done in a physical setting. Great. What we're building is a system where the data comes back to us. So our primary care physician can go back to the patient. We send many, many people to labs every day. It's all done offline and the results come back to us. I think that is critically important to get control of that, because then otherwise people are going down the rabbit hole and they're spending a lot of time and effort going to a lot of different things. Maybe they need it or maybe they don't. I think right now there's a loose connection between healthcare spend and health. And this is where all the companies here on the panel and many other companies are trying to change that. That's why I told you, Tom, when we spoke earlier, this is not digital health, this is health. This is all our health. We're just starting remotely. And then whatever people need, if they need in person, by all means, make that happen. I think you need to break it one piece at a time and give people control.
Thank you. I want to take a question from the audience that dovetails with a concern that I've had. And I'm going to start with you, Monique, and that is, privacy and the risks of, I'm giving these digital agents a lot of information about my head. And the same could be said of all of these tools. What are the steps that you take to ensure the security of the data, of the personal information that I am giving, and allay concerns about cybersecurity risk and the risk of that being falling into the wrong hands?
Sure, I think it's a critical question that we think about obsessively, and there's many, many layers to this. But I think first, often when this question comes up, there's sort of a tone of, if we can't solve this, do we move forward? And I think we have to first ground ourselves in just how bad mental health is today. If you look at this US Surgeon General's advisory that he put out about youth, and you look at 1 in 3 high school students are saying that they feel persistent hopelessness to the point where they can't function. I think we have to start from a solution mindset and sort of start breaking it down, because too often there's a kind of all or nothing thinking around this, that if you imagine the worst case in cybersecurity, and the issue of it's very serious because you can lead to loss of life. Where we are today is enormous loss of life, both through death and through decades and decades of disability. So I think we have to ground ourselves in leaning into solving the problem. And then on the privacy issue, it starts with, again, how you make the product and what your business model is. If you're thinking in terms of getting people to come more often and you're using that old way of measuring media and success, then you're going to do things that are not necessarily in the best interest of people and get data you don't need or get them to come back too often. If you're oriented around meaningful engagement, then you can do things like ask people what data they want to share, let them know the risks, let them kind of have, again, some more control about what they do. On the security front, there's a lot of very rigorous standards that you need to follow, put them on your roadmap, hire the right people, invest in those things, and pull it into your quality and compliance systems. That's just big company stuff that a lot of small startups kind of leave for later that you can't. You have to start with those things. So that's how a little bit how we think about it.
Yeah, and I would add that I would add that you, as a consumer, there's so many of these out there now, and making sure that they are following high trust standards, making sure that they're following HIPAA standards. There's a lot of great regulatory regimes and standards bodies out there that you as a consumer want to know that those providers are following, so that your information is safe.
Russell, thank you. We need to end it there. I could keep talking to you three for the rest of the day, but we're going to move on. Thank you so much, Monique, Russell, and Alon, for joining me to talk about this very timely topic.